Hello everyone, this is Dr. Praveen Kumar Tuppad from Vasco da Gama, Goa. I am a practicing periodontist and implantologist. So today I am be speaking about the instructions which needs to be followed whenever a tooth is removed of a patient. Whenever a tooth is removed, in most of the cases, doctor places kind of cotton or something called as a gauze. Gauze is a piece of cloth which is placed on that area, and the patient is supposed to bite on it for at least 45 minutes to 1 hour. In some of the cases, doctors do not put cotton pack, they just directly put the stitches. So the case to case variation is there. So depending upon that, instruction needs to be followed. Now once the cotton pack is placed, it has to be removed after 1 hour, and after removal you have to take a cup of ice cream. Okay, now how it has to be removed is just patient has to use his finger to take that cotton piece slowly out and throw it in a dustbin. They should not spit the cotton pack out of their mouth. They have to take it with their fingers, slowly take it out. It will be little reddish in color because of the blood, and it has to be thrown. Next thing is to have a cup of ice cream or a fruit juice. Now ice cream, you can use a spoon to take ice cream, and if you are taking anything fruit like a fruit juice, then you should use a glass to drink. You should not use a straw to sip. Okay, so this needs to be taken care of. Now after your ice cream or fruit juice has been taken, the next thing is to take a painkiller. Now the painkiller is taken as per the prescription which is been given by your doctor. Okay, so immediately after your ice cream, take a painkiller, because the effect of anesthesia will be there for at least 3 to 4 hours. So before the anesthesia wears off, you have to start with the painkiller. Now next thing is that what you have to do throughout the day. Now throughout the day, when you reach home after the tooth is removed, after you had ice cream, you have to apply ice pack. Now suppose the tooth is removed from this area, you have to apply ice pack on the outer surface of the face like this. Okay, you can take a plain cloth, put some ice cubes in that, and just apply it here. You have to press it. Okay, should not just keep it, you have to just press it like this. Other than using a cloth, you can use ice gel, okay, which is available in the pharmacy. They're small like gel packets, which is normally kept in a refrigerator. So that also you can apply it on the outer surface. So differ from patient to patient how you feel comfortable. Now this ice pack has to be applied for 5 to 10 minutes every 1 hour throughout the day on the first day. Okay, so till you sleep you have to apply ice pack. Okay, next important thing is that on the day of removal of the tooth, patient should not go home and sleep immediately. They should remain straight. They can sit on the chair, on a kind of a slanting chair, and watch TV, read books, whatever they prefer, but should not sleep immediately after removal of your tooth. Okay, sleeping needs to be done after 10 o'clock only, at night only. Okay, third thing is what all to eat on that first day. Ice cream and fruit juice is definitely one of the important ones. Other than that, you can have anything which is soft, anything which is of room temperature, and anything which is non-spicy. So these three things should be considered while on the first day. This can be continued till third to fourth day also. Yeah. So for example, what are the things which can be have? Like rice, you can have a plain rice, you can have a rice porridge. Okay, it's called as ganji in local languages. So that can be had. You can have lentil dal also. Okay, and it should be non-spicy. It should be of room temperature. Next important thing is to avoid any kind of strenuous activity. Strenuous activity means which increases your heartbeat, like jogging, running, or involving in some kind of play activities. All this needs to be stopped for at least 2 to 3 days. Third day onwards, you can start with brisk walk, and then slowly as you feel better, you can start jogging. Very important is that immediately after your tooth is removed, many patients they feel like spitting the blood out, which should not be done, at least for next After removal 2 to 3 days, you should not spit. If you feel anything is there in your mouth, you have to just take water or some fruit juice and take it inside. If you are a working person, you can join your work on the next day. It is advisable to take rest on the day of removal, but second day onwards you can join your work. Saltwater gargles has from the second day onwards. First day there is no saltwater gargles. Now how many times it has to be done is it should be done at least minimum 15 times. The more you do, the faster you will heal, and there will be less amount of discomfort. So every 1 hour you have to do saltwater gargles. Now gargling, when you do, you should not do aggressive gargling. Be very gentle. Just allow the salt water to touch every surface of inside your mouth, and once after 1 minute, just bow your head and open your mouth so that all the salt water will just flow off. Okay, so this has to be done every day for at least 7 days. During this period, also important is that how to brush. Now when you brush, you should avoid the area which is being operated. You should not touch the area where the tooth is removed. Okay, you should not touch that area with your finger also. A lot of people have the habit of touching with their finger and checking whether it is healing or not. Yeah? Also avoid touching with your tongue. So in short, what I want to say is that that area where the tooth is removed should remain untouched for at least 7 days. After 7 days, your doctor will call you for a checkup. Okay, sometimes third day also we call the patient, but depending upon the difficulty level of the tooth removal, on the third day or maybe 7th day, the doctor will call. If the stitch has been put after 7 days, it has to be removed. 7 to 14 days is the range where the stitch has to be removed. So these are the important instructions which you need to follow whenever a tooth is removed. And all these instructions does not mean that patient will be absolutely fine after following all the instructions, because every patient is different and everybody's healing capacity is different, and as per that there will be some modification which will be advised by your doctor on case-to-case basis. If anything which I have missed, if any queries which has not been taken up in this video, please comment in the comment box, and I will try to answer them. Thank you so much.